I would also suggest that simply by creating a national healthcare system, you are not inherently creating a Canadian system or an Australian system or a French system. This is the United States. We do not have to mimic our healthcare system based on someone else's. We can, if anyone can, find the balance between access and innovation when it comes to our economic growth.
You know, I'm sure as early as kindergarten, you can remember your parents and teachers taking privileges away from you when you did something wrong. Though we didn't understand, the point of the reprimands was to remind us that actions have consequences, that the things our parents give us are privileges, and that they could be easily taken away when we broke the rules. A government is arguably the only entity in the world that does not operate under this basic rule of reward and punishment. When it breaks the rules, it gains more control over our lives, not less. It never learns that what it did was wrong, and it wastes privileges we give it through our tax dollars. The stimulus is the most recent example of this unwarranted reproach because it ignores, amongst many other things, the human cost of health care. The stimulus wants to authorize the creation of a federal council that would take away the rights of patients and physicians to determine their own treatments based upon safety and patient needs, instead making decisions for patient treatment for people based on what the government has deemed cost effective. So in that way, it's kind of like a golf game. The lower the amount that you cost the government, the better for them, not necessarily for you. Such policies ignore the human cost of health care. We talked about Great Britain in the past questions. There's a country with universal health care. This is the kind of single-payer system envisioned by the other side, where a 46-year-old woman named Debbie Hurst who has breast cancer is unable to get access to the drug needed to save her life because the government won't provide for it. And when she tried to pay the $120,000 drug cost out of her pocket by selling her own house, the government told her they'd kick her out of the healthcare system completely if she tried to take care of
cancer. It shouldn't matter that they're a congressman. If a child has strep throat and it is moved to their liver, it shouldn't matter that because their father isn't a congressman or a wealthy business owner, they can't afford health insurance. What Obama was talking about specifically was simply access to health care.
Republican Speaker, I'm a PCOM major. Mr. Speaker, Mr. Republican Speaker, with the cost of health care in this country spiraling at 2 or 3 times the rate of inflation, you mentioned earlier, do we want a bureaucrat choosing the most cost-effective method? But it seems to me that there isn't anyone who's choosing the most cost-effective method. So wouldn't a bureaucrat be better than no one?
Well, again, it's a question of logic. I mean, we can all agree that there's a problem, but why does it mean that that has to be the solution? Why can't that be the solution, or that? And the issue specifically with regard to a bureaucrat is that you're right. Healthcare costs are spiraling out of control. And a large part of that, though it's complicated, is that there is no conception of supply and demand in the system. As a result of exceptional premiums and deductibles and not a lot of out-of-pocket costs, no incentive to save for your own health care, no individual involvement in the system, people have no conception about how much things really cost. That's why you'll have parents send their kids to an emergency room when they have a temperature at 99 degrees. I see it all the time. My mom works in a doctor's office. I mean, because there's no conception about how much things really cost. So the question we have to ask ourselves is our solution going to be, let's separate supply and demand even further from the people that actually need to understand these costs because they're going to be bearing the brunt of the outcome of them? Or are we going to give them a sense of the reality of these costs so they can be smarter about their own preventive care, be smarter and more judicious about how they save, and have the system be more reflective of your individual wants and needs through supply and demand?
Thank you. Quint, you have 30 seconds.
Just quickly. I think you're right, Sam, and I think the important point to note here is that when it comes to blaming bureaucrats, there is no organization filled with more bureaucrats than an insurance company. When people are being dropped because they have cancer, and while they're trying to get chemotherapy, they're calling other insurance companies up, desperately trying to get the insurance they need, who are they dealing with? Bureaucrats. And it is simply not true that Obama's plan will create a new bureaucratic bureaucracy. His plan does not call for centralization. It calls for expanding our private enterprises and creating competition among them.
Thank you. Next question from the audience.
Concerned about you and I. What's interesting about that is it's only about you if you're a wealthy white male, and the I is the private sector that is completely bankrupt and unable to provide any of the economic stimulus that my proponents are opposing. So clearly, my opponents would prefer. What we need to understand is when he says that this is the stimulus loaded with pork barrel and maybe can point out one or two projects, he ignores the billions of dollars that's going to go into education, to help modernize our schools, how this is an investment in the future of allowing us to have long, stable economic growth and security. That's what's important. Transportation. We have an electrical grid system that dates back to Thomas Edison. It's time that we did something, and it's time that we do something that's going to help our economy as well. This is not only to address the economic concerns of our nation, but the investment in the future of allowing us to overcome this by creating jobs and modernizing our nation to allow us to emerge as a stronger nation under this economic recession. Now, he talks about fiscal discipline, but if he was listening at all to my speech, one, we need to understand that oversight and transparency is what's going to be most important in executing this plan. And Barack Obama has already put out the recovery.gov where you can go and actually see exactly how the money is being spent. We're learning from the mistakes of the Bush era.
How does a $8 billion high-speed rail in Nevada, which is incidentally Harry Reid's district, create long-term jobs that this economy desperately needs?
2 ways. First, transportation, in order to build that, requires construction. So first one, you're going to be investing in companies by buying the products that are necessary to do the construction. 2, you're going to be employing the workers in that construction business that will be building the railway. And 3, you're going to increase the businesses that are between Nevada and Las Vegas that will benefit from the transport system. And many of our transportation infrastructure throughout the nation is so outdated that we'll see that this is an investment in our future by making our transportation more efficient and more modern.
All right, so from what you said, you were going to create jobs, but to me, construction jobs, once the project is completed, the work is done. So I don't see how this is going to create long-term jobs. But aside from that, how does, let me see, $50 million for the National Endowment of Arts and other pet projects, such as $1.3 billion to Amtrak and $10 million to urban canals, which I don't know it even exists. I haven't seen a canal in Manhattan in quite a long time. So how do these pet projects and pork barrel spending going to actually help stimulate the economy with jobs?